My name is Beatrice Asu. I come from Ghana. I was diagnosed as kidney patient. So I was introduced to Dr. Sharmila, and I got in touch to this hospital. So when I came to, I went through all the procedures. So I was also able to go through my surgery very nicely. The nurses were good to me. The doctors too were attending to me. Everything was okay. So I enjoy staying in this hospital, and I hope I will go and then say a lot about this hospital. They are very kind and good. Thank you. Okay, Dr. Sharmila, when I was introduced to her, when I went to her at the office, she was very good. The way she accepted me, the way she attends to my problems, I was very happy. And when I was brought to the nurses too in the hospital here, the nurses too were very good. They were coming, attending, asking whatever I want. They do everything nicely. And then the infrastructure of the hospital too, everything was nice. I was isolated, I had my bed, everything was dressed. The hospital itself was very neat. Those attendants, I would say cleaning and all those things were very nice. And then the hospital was is beautiful. I like it. Yes, if I go back to my country and I want to talk about this hospital, I would say I've seen hospitals, but this hospital was very nice. And there are things in the hospital too were neat. Everything, I would say, I don't even know what to say. The hospital was nice, and then I admire the hospital.
Hello friends, I am Dr. Sharmila Thukral, consultant nephrologist at R N Tagore Hospital, Kolkata. Today I will be talking about a patient, a lady from Ghana. She is 50 years old and she has been suffering from hypertension for a long time, about 18-19 years on antihypertensives. She developed a chronic kidney disease and ultimately an end-stage renal disease, for which she was being dialyzed in Ghana with a tunneled catheter. She was suffering a lot because she used to have fever, chills and rigors during the dialysis time. She was referred to us for a renal transplantation, and she came to us suffering with again fever, rigors and chills here also in the dialysis unit. On investigations, it was found that she was having an infected catheter. The tunnel catheter which was done was infected, and she had very raised inflammatory markers like raised CRP, raised procalcitonin. The catheter was then removed by us, and we put her on a temporary catheter with which she was dialyzed. She was also given intravenous antibiotics which were culture sensitivity, and the blood culture was showing a organism in the blood which we treated. So gradually she became better and her fever and chills and rigors went away. Her repeat blood culture was also negative and she responded well to the antibiotics. After that, we went ahead with the renal transplantation. She was transplanted on the 11th of this month. Post renal transplant, she has been fine. She has passed adequate amount of urine. Her renal functions are also fine. Somewhere during the course, she had a little rise of the creatinine, for which we did a renal biopsy, and she had a little focal necrosis which is improving now. She has a good graft function and she will be discharged shortly. The donor too is now fine, and he underwent a laparoscopic nephrectomy, and he's passing adequate urine and he's normotensive, and he has also flown back to his country today, and our recipient too will be flying back in a week or so.